I saw where a gentleman now was hospitalized because he used ChatGPT to change his diet, and they told him to do something, and now it caused him to go in the hospital. So, how does your platform avoid some of those pitfalls that technology can get us into?
First of all, I think Chat GPT is an excellent tool when used appropriately. And maybe there should be some federal, some regulation there that says don't try this at home. Something. I come across people every day. Well, what makes your tool different from Chat GPT? Many issues. If you go back to a disease that was just found within the last year, Chat GPT is not going to have it. Because remember, that's still a human somewhere entering this data. So what I did on average with the chat version that I use, I couldn't get good information that was 2 years old or less. We did these studies. That's not down in the product, but that's where we saw a glitch. And we're not trying to answer all questions. We're basing all of our answers off clinical decision tool trees. Our algorithms are based off of decision trees, based upon information developed in health organizations, white papers, clinical studies, and just traditional data mining. Man, the first time I tried to throw data into a machine learning application to try to identify trends when it came to the allergy space, it didn't work because there's so much overlap in disease. Like for instance, this person you just said was hospitalized. They probably got an answer, but it probably wasn't for their true disease state because there's so many other things that go along with it. Your patient history. So it really has to be a nexus of information. You got to pull your medical records in. You got to pull in your symptoms. You got to pull in where you are in the world, especially if it's an environmental allergen. You got to know where you are in the world. Then you got to understand that I just ate a piece of fruit and then I'm starting to get symptoms like when I was out in the woods with the grass and the pollen. I got an oral allergy. It's not going to do all that. It's not going to tell you what the truth. And another feature is it's going to give you, which I think is pretty neat, over-the-counter treatment protocols, prescription level protocol, and natural and herbs and supplements. It'll give you all three of those, so you can start to treat yourself. But most important thing is it's going to tell you call your doctor. And if this is an emergency, don't call. Are you allergic? Call 911.
1-1.